First of all, you need your mobile phone and please you can contact here.
It will be put on Play Store, but it's not yet. It's
in the developing phase, so it's not on Google Play. So we are just trying to find a way to make it.
For example, if you have your number, I can send this but first of all, first I need your image and software from
Okay. Hello, my name is Marko. I will show you now how Fungal Case Finder works. So we have our problem, that is fungal infections, and we have our solution, that is fungal case finder. So fungal case finder consists of three parts. One is tool for taking samples. Second is a mobile application, and third is computer software where we put our data. So first, I will show you the mobile app. It is still in development phase, so it is not on Play Store. But if you want to try it yourself, I will send you a link to download. Our app is patient-oriented. It means that patient should download the app and do like quiz, which will tell him or her what.
And then we have some questions. Most of them are yes or no questions, and we have question for duration of the symptoms. For example, I'm gonna put up to 12 months, and then pain sensation in head areas. For example, yes, face no, ears yes, and so on. Visual problems, we have that section. It's also yes or no. Nasal respiratory sense problems. It's not really important, just to show you how it's done. And then sleeping and day activity problems, for example, yes, both. Then it actually scores each one of your answers and then add that up so you can have your final score. It's in this case 13, so you actually do have chronic sinusitis. It's just preliminary results. It's not substitution for clinical or microbiological examination. Yes, it's just for you to know whether to schedule your doctor appointment or not. And then you have, it's in Serbian, I don't know why, but it's the button where you can schedule. It actually shows you the link for scheduling appointments at your doctor's office. And that would be in sinusitis. I'm going to show you nail diseases because it has like a part with the graduation of your symptoms, whether it's low or high, but the principle is pretty the same. Here you have to compare your nails, your patient nails, to pictures from your app. For example, we're gonna choose this one, Same thing here. And with symptoms now we have to, if you put yes, for example, you have to grade that whether it is low or high. For example, high, it actually adds up to your score, so it's very important to put low or high. We're gonna just do some random answers here. And then we're done. As previously said, now we have final score, and then we can, our app is comparing that to their databases, and then you know whether you have is probability for you high or low to have a fungal infection in that concrete area. So later we will send you a link where you can actually download that app, and then you can show other sections, but it's pretty similar. It's just yes, no questions and comparing some pictures or schemes to something like a secret or nail bats. And that's it. That's for that app.
Yeah, it's actually interesting.
Maybe
So
you
it
have some
only has
questions.
these four
Yes,
components.
yes. I previously said it's just in developing phase, so maybe it would
Have some more components.
yes, yes. But for now, it's just these four sections. Yes. Yes, actually, Fungal Case Finder has three components. One is a mobile app, another one is computer software. I don't know whether our presentation actually includes that, but I will ask our professor. So that's the second component, and then we have like sample collecting tool, and when you combine those three, you can actually do this graduating whether you have or not have fungal infections.
How can we quit this application?
I'm sorry.
How can we have this application?
Yeah. I think it will be put on Google Play. So it's just in the early phases where it's not just finished yet. So after I don't know some software perfectioning of the app, it will be put on Google Play. But for now,
You submit that online with your cases or
sorry.
you submit with your cases?
I'm just a student, so I don't have patience, but maybe professor actually used it. I mean, she probably should have tested it somehow, so we actually work together on some projects, so maybe we actually use that computer software, but for app, I'm not sure. Maybe it's for the best for to ask her for that. But software was really useful. It's just like anamnesis. It consists of demographic questions, like personal data about current therapy, other diseases, lifestyle habits such as smoking or alcohol consuming or whatever. Previously had fungal infections and I think some lab analysis or data, and that was included in that software. And that also I said combined with this, and that is sample collecting tool. It's best combined.
Now you click observation. For example, if you see red, we get a message.
Oh, you want to cry? We get a message that it is. We get a message that it is most likely not fungal infection, but we can continue to analyze if we want. But if we click, for example, this, uh, this, then we get a question here. And again, we fill it up and get the result. For stomatitis, it's pretty identical. We have different discolorations. Here, for stomatitis, we are focused on patients with uh, prothesis for false teeth. So because they are risk group, and then they can have candidiasis. Also questionnaire. And for vulvovaginal candidiasis, we get what type of secretion does the person have. For example, this also, and that's the application. So for now we have a Serbian and the English language. Okay. Now I will just see how to open the software so that I can show you. Kako mi da pustimo software? Ja to ne znam.
Preko mog, ja sam
Pa ne umem ja da pustim.
nemaju, evo ti, možeš ti ovdje da pokazuješ, hoćeš dedno,
Da.
evo, možeš ti sada da ti ja odem tamo.
Ajde.
Znači, uloguj se, a ja ću ovo preko toga.
Pazi. Hello? So this is our software for putting in data. After a patient sees on the mobile app that he or she has a high probability of infection, they can come to us and we can take a sample. And then we put data here. So our software consists of 7 parts. First part is demographic data. So what age is the patient, what job is he working, etc. Name. Okay. Next part, second part, is his everyday activities, or if he is a smoker or not, what risk factors does he have. So here, smoking, alcohol, drugs, and other. Then third part is systemic conditions, so systemic diseases. There we have diabetes, cardiovascular diseases, respiratory, etc. Then what is if a patient is on some therapy right now, we type that here. So biological therapy, corticosteroids, immunotherapy, cytostatic therapy, antibiotics. Then we have dermatovenerological illnesses, diseases. Or just a second.
It's animals or some,
Only paper, moj.
for example, using scar centers.
No matters. Да. Okay. So number 5 is past fungal infections. Then we can also put in no. So yeah, that's 5, and then now 6. Sixth is what is the clinical picture now. We can put how much of a nail discoloration is how much of nail is discolored, and other things. We can put here how much it is from this side, etc. Okay, this is for skin diseases.
Sorry to cut you short. This is the screening part of the clinician, not so.
No, screening part is on the application. This screening, and then they come to the lab to take a sample. We take a sample and put patient info here.
I think the main difference is this is where the doctor will put it
Yes.
the objective.
Yes.
I assess that it's this much, not how you said it.
Okay. Yeah, actually, that's what I meant. Like it's the doctor assessing the patient and then entering the information there.
Yes. So patient do the app patient uses by himself, and then he comes to the doctor, and this is what the doctor sees, and doctor inputs information. Okay, and then seventh part of the software is laboratory lab findings. So we can. Here is the date of taking of the sample, and we can also put some pictures of the samples or the colonies, or we can put pictures of patients' discoloration or patients' nails or whatever. So that is the software. Did she tell you about the application? Did she show you? Yeah, okay. And that is all. Also, there is that tool. I don't know if you have seen that tool for sampling. Okay. Jel ima još neka ta da pokažem njima? Dobro, evo ti. Možeš ovdje da mi pokažeš.
Ovo je za sinuse, to ću posle ja im objasnim. Ovo je za nokte.
Znači, ovo je bijeli za sinusi. Jel? I ovo je bijeli za sinusi.
Ne, za sinuse su ovi. Ovo je za sinuse.
Ali ovo nisi svoj. Aha, ovo ide svoj.
Nije mi dobro.
Čekaj. Ovo mi treba.
Vidi se ovi možda.
Dobro, evo ga.
Ne, kontra, mora to ide kontra.
Ovako? Što to? Dobro. Okay. So this is the tool. It is better than what we have right now because it is more rigid, so it can scratch a surface a little bit and take better samples. I will give you. So the goal is to. This part is, I think, from sinusitis, and this part is for nails, so you can scratch it better. Okay. Now, when you finish taking a sample, this part stays clean and is reusable, and you only change these parts. So you put it here, and then take sample and put it inside and break it off, and it will be like this inside in the medium, and this is also in development. It will be intellectually protected. It's in process. So after that, we are going to put it in yeah. Yes, yes.
Is that meat in there?
What?
Is that meat in there?
Yeah, you can put medium in there.
Oh, you just add the meat.
Yeah.
Come with
No,
meat,
I don't know if it will come with the medium. So, but it is better than usual. Yeah, because it is it better conserves microbes or fungi. Okay, so this is that, and we also have this other side, and we put it like this, and then take a sample, and also we can then change that and.
Actually, very clever. It looks really nice.
Yeah. Also, I think it will.
It can be used for purposes like collecting urethral samples and vaginal samples as well.
What?
Urethral samples and vaginal samples.
Yes, yes. Yes. This one can also be used for vaginal samples. Okay. Now, if you want to see,
This could be
This one.
yes, yes. I think I will ask, but I think they scratch nails, and under that is like surface, and they get what falls, and then put it in the medium. But I will ask.
you can collect the sample.
From this information, you get a score afterwards. Or is just
Uh,
information that you put there?
I think that we also get a score from that. But these informations are much deeper than the analysis on the application.
So the white one is for the vagina and for the sinus.
Yes.
This one for nails and for skin. And this one
And for
the skin. For the
the
skin.
skin, yes, I think this one can also do for the skin, but we will ask the professor. Also, there will be a metal version of that, so that in hospital they can sterilize it.
Oh,
But this one is for a single use one.
this one.
Yes.
This one was made of.
Plastic. I don't know.
Simt că a fost o problemă la un moment dat ne-a întors. Da. Căutam să-l așa. Deci să zicem că vreo jumătate de oră a fost asta și vreo jumătate de oră mi-a dat mine la toate să scrie quiz.
Šta za sinuzitis? Ali treba da ti vratim ovo.
Ali za sinusa mi treba još jedan onaj...
A šta je za sinus?
Okay. This is our last project. This is something that patient needs to put inside, but this is non-sterile part, and for this reason we need this double how to say with this component. And for the laboratory examination, we then use only this. In order to avoid contamination, we have sterile for example, and to put this by some this is not very other. Okay, but in media or direct on the plate or something like this. But all these tools are still under development, and we are hoping to continue with this project and to in collaboration with the physicians to get some proof of evidence. Okay. I hope it was clear for you, but of course we have many also questions how to continue, which sample to use, how to test, because what is good performance when you have a whole sample, then from this, first of all, you can measure the quantity, the cells, the genome, or we can extract all genome from the sample to measure this and to perform different analyses. For example, direct microscopy, culturing, PCR, or some other. This is the a positive effect of this way to collect sample. Uh, as you know, we have a pre-analytic stage when physicians suspect some fungal infection or any infection. Then we need to explain how to collect the sample, and this is usually the step with many mistakes. For example, contaminations or a low quality of sample. And if this first step is not standardized, and we know as microbiology that in many cases is it not possible to standardize this, we hope that by using these sampling tools, we can improve representatives of sample of taking sample. The second stage is analytic stage, and during this is something that we perform in our lab, and this stage usually very strict. We follow a standard operative procedure, and mistakes are very rare during this stage. And post-analytic stage is our interpretation what our results exactly means. And this is answer that you ask the question many times, because fungi are everywhere, as Professor Mika Maras told, and we need to clarify if this is microbiome or microbiota, normal colonization of skin or mucosa, or it is fungal overgrowth. By using this method, we can also count or measure the fungal growth, especially for vaginal candida infection. Also, if we have mixed infection, this is also could be useful. And the main idea, tomorrow my student will give talk about this, how to differ normal flora or microbiome, vaginal microbiome from infection and from complication. For example, recurrent vulvovaginal candidiasis is complication during some condition, or in some high-risk patient, for example, pregnancy or diabetes or some other immunodeficiency. If you have any question or if you have any suggestion how to continue with this. Okay, yes, good. The final step, but I think maybe in few years, we are trying to prepare something like this, for example. This is some test, I think, from Romania for self-sampling. Yes, for self-sampling and transporting. And I'm planning to collaborate with this group in order to they have some different platform, but okay, maybe we can find what is the this is, for example, part of their products to take and put in the media and transfer to the laboratory. Uh, what is why this is important? By using this, you save the patient time, you save doctor time, and you we are also preparing some education for patients, because in high risk patient or for the chronic infections or disease, the education is very important, because patients need to take care about disease, and to can educate himself or herself how to live without losing quality of life, because these superficial infections are rare, linked to the late outcome, but no late, sorry, fatal outcome, but significantly affect quality of life. And patients are very motivated to learn about this and to participate in own health. For this reason, this is very good because fungal infections are chronic, and this usually some aesthetic discomforts, but patients are very motivated to solve this problem. And if you use this positive prediction of patient, you can use patient experience how to dealing with this further. All my idea comes from this, because patients, especially women with vaginal infections, they do not like to go to the gynecologist only for to take sample. Okay, routinely yes, but if some infection occur, it's more likely to take sample and send it to the lab. This is from my experience. I don't know what is yours. Is it?
Who produced these goods?
Ah, yeah. Yes,
Is it
yes.
option for register?
No, still not registered. This is some, kako se zovu ovi što su vi pravili ovo, kako se to zove? Modeling. Yes, 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 yes. Sorry. Yes, 3D printing, but it was possible to sterilize. It was sterile. It was very important for us. And we tested more than, I think, 500 patients, mostly dermatologists.
You work as a 3D modeling or 3D printing, you can maybe examine different shape of nose.
Yes. Just right. We have three mode of shape for intranasal, but this is really difficult for sinusitis. For vaginal infections is more easier. But okay, this is 4 conditions that we are choose to apply these new tools, and maybe if we got new project, so we will continue with commercialization of this.
Who is going to use this?
Sorry?
Who is going to use first this software? Primary care physician or dermatologist?
This is good question. Now, yes. From my experience, physicians, clinicians are not involving very much in fungal infections, except dermatologists. And if they have some platform which guide them how to, what to ask, how to collect, we can offer this knowledge to large part of professionals, but
Like nurses,
yes, great, like nurses, yes.
then
Yes. Yeah.
nice idea.
Thank you.
We work in the same time some addiction study with the regular sampling with the
Yes. We usually perform in parallel, taking sample, but for example, you will leave, but tomorrow, Dr. Savica will present sampling for vaginal candidiasis with swabbing and with this scraping method. And this is, sorry, yes, for nails also. But for nails, we usually use the some from surgery, and but this it will be something for single use. For single use, this is very important.
Enough sharp? It's not in
We have until now several sharps of this. Some different. You see, this is.
take samples from nails. So which equipment do you use? Protective equipment. Mask, gloves.
No, nothing.
Really?
Yes,
On
nothing.
onychomycosis?
Yes, it's nothing.
I read that you need
No,
mask,
no.
not in the laboratory, but for techniques where you're taking the sample from nails.
No. It is not, yes, but not, no. No, really, no. I don't know in Ljubljana. Jelena from Ljubljana is here.
Read about that a lot for
No.
read about glasses, for example, but you don't have.
This is some new rules in, yes, this is general rules, but in real laboratory life is not very
Because
common.
we have a lot of patients, we have a list of waiting to the July in Zagreb, and it's for onychomycosis, yes.
Okay, we have solution.
And we are taking samples almost every day, and now we have a PCR for dermatophils.
Yes,
And
but
can we tomorrow discuss about it?
yes, of course.
Excellent.
Yeah.
We
Okay.
have cultures and the PCR.
And direct microscopy.
Yes,
Direct microscopy is very important
yes,
for
yes, of
fungal.
course.
Okay.
But our
Okay.
patients use a lot of medicaments.
Yes, great. This is the problem.
And they
This
are
is the
almost
problem.
always negative, focus positive,
But first of all, you should ask patient
we
about this.
told them you need to wait more than 1 month
Yes,
and
I
everything,
know.
but they
I understand. Yes. But what is very important? Ideš, dobro, važi, ćao. Možemo. Što je važno? Važno je da objasniš pacijentu da će dobiti negativan rezultat.
Znači ja ih nazovem, oni ih nazovem, kažem sve to i to, inače to džaba je. Znači on dođe, ja ga opet pitam, baš me zanima šta će oni reći. Ja dođem na uzorkovanje da vidim i on kaže, ne kažem kad ste počeli, jer će on reći, nisam ništa.
Dobro, mi se vidimo večer.